So greetings and salutations. I'm Senator Marshall Bullock. I am the chair of the Michigan Legislative Black Caucus. And on behalf of each and every member of the MLBC, which is comprised of a very diverse membership of legislators elected around the great state of Michigan, we welcome you all for tuning in today to take part in our forum, making sure that our Black and brown communities who have been devastated from the COVID-19 coronavirus get credible information on the many, many COVID-19 vaccines on the market and all of the myths and even the ones coming to market. So we're gonna do some myth busting so people in our community can make intelligent decisions and have good, credible information. So before we get started, we're gonna start with a short, small survey. If the vaccine was available for you to take today, would you? Would you A, take it immediately, B, take it eventually, C, take it only if mandated, 4, not take it at all, and 5, have you already taken the vaccine or at least got your first shot? So you can answer that poll question right there. We'll let a few people chime in on the poll for a second there. Yeah, that's what we're doing here. And we just want to make sure we are educating our community, making sure folks have good, credible information, like I said. And we've got 2 great panelists here to discuss all of this going on with the vaccines and what's happening here in Michigan and how that we help our communities do what's right and do what's best for them. So I see Brother Nate Ford just logged in. That's good stuff. So we can wrap the poll up right there. 1 minute on the poll. And so with all that being said, one of our panelists today, even though he's on the Eastern Seaboard, Dr. Reggie Eadie is a native Detroiter and a graduate of Detroit Public Schools, Wayne State School of Medicine, and the Michigan State University Broad School of Business. Dr. Eadie spent many years at the Detroit Medical Center, but recently left Detroit to become president and CEO of Trinity Health of New England out in Connecticut and Massachusetts. He was recently appointed by their governor, Governor Lamont, as the co-chair of the state of Connecticut's Vaccine Advisory Group. So I want to welcome everybody, my friend and my fraternity brother, Dr. Reggie Eadie, and he's going to have a great presentation for us.
Thank you, Senator. You want me to jump right in now?
Yes, sir.
Excellent. All right, so I will start off, let's see. I've got about 6 topics that I'm gonna spend just about 10 to 15 minutes on. So I'm gonna talk as quickly as possible so we can get to some Q&A. And I also know Dr. Khaldun is gonna grace us with her presence as well. So these are the topics I'm gonna go to the extent that I don't cover them in depth to your satisfaction. Please feel free to drop a clarifying comment or question in the chat box, and we'll get to them during the Q&A. So here's a slide I put together. The purpose of this slide was really to capture the number of deaths we've experienced in the United States per month. And as you can see, back in February, when the first case was announced in the state of Washington, followed by in March, we saw some 77 deaths, unfortunately. And this is when we realized that we had the coronavirus in all 50 states. We peaked as a country in mid to late April, and then saw a steady decline in May and June. And then we sort of flattened, if you will, up until just as predicted, Halloween, Hanukkah, Christmas, Three Kings Day, Kwanzaa, New Year's Eve, and then the New Year's celebration. And then it all started all over again, and we now as a country are experiencing what I consider to be surge number 2. The difference between this surge and the one at the beginning of the year is the steepness in the curve and also the area under the curve. So in other words, it was probably a 3-month surge 1, but probably likely going to be a 4 to 5 month surge 2. That being said, we ended 2020 with it being the most deadly year we've ever experienced. Let me repeat that. The most deadly year we've ever experienced since recording in the history of the United States of America. And then unfortunately, January broke a record because that was the most deadly month we had ever experienced in this country since recording. And then there's a great state of Michigan, and Dr. Khaldun is going to get into more details, but just to remind you and compare, you guys have seen over, I still speak as if I live in Michigan at times. You guys have seen over 500,000 cases, unfortunately over 15,000 deaths, and you are seeing up to 19 deaths per day. Let me talk just a bit about Operation Warp Speed. So this is one of the most commonly addressed or lifted up concerns, and that is the speed in which the vaccine was produced. I am not going to spend a lot of time on this busy slide. I'll just lift up, if you will, I think a few salient points. One, you see in the red circle, on average, it takes in America on average 73 or 6 years to produce a vaccine. And those are the multiple steps. You see the stages by the color coordination. There's a legend at the bottom of the slide. But then the challenge or the charge was to produce in the midst of a vaccine, because remember, we're now talking about while we were experiencing surge 1, remember we had almost 6,000 people die only in the second month of this surge in this country. And so our federal partners then charged the manufacturers, the scientists, to produce a vaccine, and was given a target of 14 months. Thank God they were able to produce a vaccine, our first vaccine, in less than 12 months so that we can start inoculating the citizens across the country. Just a couple points I want to raise on this slide. One, you should know that in the production of these vaccines, there's a technology, and I refer to it as an RNA technology, that existed many years prior to the pandemic even starting. This technology, which you may or may not be familiar with, was used primarily for creating a vaccine and a cure for cancer in our country. So that's one point I want to make. It is not new, this technology. They stopped a line and transitioned over to create readily a vaccine to get us through this pandemic. The second point I want to make, and this is really where the anxiety comes from, the accelerated vaccine process that we've heard about, and that is that this process, once, did not skip any steps. Two, and I think of equal importance, it did not jeopardize quality, safety, or efficacy from a vaccine perspective. So this was just a catalyzed or accelerated way, because of technology that already existed, for manufacturers to produce a vaccine quickly so that we can start transitioning ourselves, if you will, out of the pandemic. That being said, I want to just spend a little time on this slide and I'll wrap up shortly. So this slide, let me orient you to it. So this slide in the purple has in the first column the manufacturer and the characteristics of each vaccine. The third column is Pfizer's vaccine. Second. The third is Moderna's vaccine. Fourth is Johnson & Johnson, and then last is AstraZeneca. I chose these obviously because we got Pfizer first, we got Moderna second. Johnson & Johnson just applied for emergency use authorization. And then AstraZeneca, we believe, although they're sort of retooling their current vaccine so that it is compatible against the variants, but we expect that they will be applying, and we hope that they will be applying for emergency use authorization in the very near future. So let's spend just a little time on each of them. So let's look at Pfizer first. So Pfizer is an RNA-based vaccine. We kind of talked about that on the previous slide. As you know, and those who've been vaccinated, it's 2 injections, 21 days apart. The efficacy, how effective is the Pfizer vaccine? It has an efficacy of 95%, which essentially means for every 100 citizens in this country that are inoculated, 95 of them will be resistant or immune to the coronavirus. That leaves 5%. And the question now becomes, what do we know about those 5%? Can they get infected? Will they serve as carriers? Those questions are yet to be answered. We think we have a pretty good idea of the answer, but suffice it to say, and I think what's most important about this vaccine and the others, so I won't repeat this, is that all of those, regardless of the efficacy, that participated in the research and who've been inoculated post-research thus far, 0 people got so sick, 0 people got so sick that they need to be hospitalized, 0. And then how many died in relationship to the vaccine? That will also be a 0. So even if you are inoculated, whether or not you can still get or carry the virus, you will not be so sick that you need to be hospitalized, placed on a ventilator. You don't have to worry about dying after being vaccinated. Then there's Moderna, which is very similar to Pfizer. There's really not much difference except the storage with the alter code storage required for Pfizer, regular household freezer temperatures required for Moderna. Moderna, another difference is that it's 2 injections like Pfizer, but 28 days apart. And the efficacy for Moderna is pretty close. It's 94.5%. So those two are based solely on the RNA technology that we talked about. And that's why we received those 2 vaccines in our states first. Johnson & Johnson is a little different. Now they have applied again and are waiting for an answer for their emergency use authorization. And this is a little different. Before applying the RNA technology, they actually took the adenovirus, which is the virus that is responsible for the common cold. They took the adenovirus, deactivated it, added the new technology, the RNA, and that's what they're injecting into the muscles of Americans. Now, what's different about the doses here is that Johnson & Johnson only has or requires 1 dose as opposed to 2. The efficacy it's a little lower, arguably. One may argue that it's not. It says on my slide, it's between 72 and 85% after 28 days. But what's important to remember, and that is not a low score or a bad score. You may look at it as the Pfizer and the Moderna, you got an A on your test, or the Johnson & Johnson, you got a B on your test. But suffice it to say, what's important is that those lower numbers are lower, a little lower, only because they put them up against the variants that now exist, which obviously is going to make it a little more difficult or challenge. So that slightly lowers the number. And then AstraZeneca is similar to Johnson & Johnson, and that it uses the adenovirus plus the RNA, but it goes back to 2 injections. And instead of 21 days Pfizer, 28 days Moderna, this one has a second injection after the 30-day mark. Let me draw your attention to the bottom of the slide now. And I just want to remind you that a lot of this, with the exception of the RNA technology, is not novel information to either of you. What I mean by that is all of you who are familiar with or been inoculated by the flu vaccine, recall that it started off as a live virus, the influenza virus, that they deactivated or inactivated. It's an annual injection, and the efficacy is 50% on average. Now look, 50%, remember Dr. Fauci said that if we can just get a vaccine that has an efficacy of 50%, we're good to go as a country. He was referring to or referencing the flu vaccine. So having something that's greater than 50%, according to the experts, is good, and all of the vaccines that are available are passed or greater than 50% efficacy. And then last, the measles, mumps, and rubella. We all in America have had the measles, mumps, and rubella, or should have. And look at this. This is just like Moderna, and that is 2 injections, 28 days apart, and you see the efficacy is 97%. So again, besides the RNA technology, which is not new by any means, it has been in the laboratory and under study for many, many years. They stopped the line, shifted in the midst of the pandemic during our first surge, and then the federal partners then asked the manufacturers to quickly come up with a vaccine, and they did just that, and very successfully, I may add. So narratives, rumors, mis or disinformation. Let's talk about that for a second. First of all, I think I can speak on behalf of the caucus, certainly Senator Bullock, and I'm sure Dr. Khaldun, that we are very sensitive to the fact that there's hesitancy in Black and brown communities. It is not to debate. We do not intend on debating you. We understand and can sympathize and empathize with you as to why you have hesitancies. And you can see there, I have at the bottom left of the screen, a reminder about the syphilis study where over 600 men of color in Tuskegee, Alabama, either were injected with or were exposed to syphilis. They were attracted to the study because they were told they would get free health care. So a little bit of deception in there, which I'm just acknowledging as a fact. And they refused to treat these individuals because instead they wanted to see what impact syphilis would have on their central nervous system, their bodies, etc. And for some strange reason outside of that wrongdoing or behavior, they also knew that they would be spreading the syphilis through the communities in Tuskegee, Alabama, and beyond, because there was that large migration of Southerners to the north, like cities of Detroit, and I would suspect that with them came syphilis as well. And then there's Henrietta Lacks standing next to her husband. She is a victim of cervical cancer. If you don't know her story, I encourage that you get familiar with it. But long story short, her cells were used unknowingly by scientists, and until this day, literally until this day, there are what we call HeLa cells, which stands for Henrietta Lacks, there are HeLa cells in the laboratories across the country and across the globe that her and her family did not give permission to use. But nonetheless, it's in use. We've learned a lot from Henrietta's demise and her experience with cervical cancer. And she died, again, without even knowing that her cells were being used in the laboratory. So suffice this slide in conclusion to get to a couple points. One, you cannot get the virus from the vaccine because it only uses a portion of the RNA from the coronavirus. We may get into this more later, but you cannot get the coronavirus after being vaccinated. There is no microchip. That has been researched. I've had the opportunity to speak to at least representatives from Pfizer in person, and they assured me that that is not the case. Remember, the Federal Drug Administration and the CDC and others have been looking over the shoulders, if you will, of the scientists to make sure that what they did and what they claim to have done has been or was validated. It doesn't cause infertility, it doesn't cause miscarriages, and it cannot alter your DNA. Remember, it's an RNA-based vaccine, and the order of production, it goes from DNA to RNA to a protein or some other substance being made in your cell, and that's a one-way street, if you will. It never goes protein, RNA, and DNA. Therefore, injecting RNA into your muscles cannot impact your DNA. I thought I'd just add this slide. This is only on Pfizer, but the stats are very similar for Moderna. But I wanted you to know as a reminder that the overall efficacy for Pfizer, as we talked about earlier, is 95%. When you look at people of color, particularly African-American and people from the Latinx community, the efficacy for those two groups are 100% and 94.4% respectively. So that in and of itself was enough to convince me, because I started off very hesitant and it was almost going to tell the governor of Connecticut that I would not be a co-chair because of the hesitancy that I had. But because of my hesitancy, I had the ability to sit down, have conversations with researchers directly involved in the production of this vaccine, and was assured that it was safe. And so we have given a lot of these talks, but this slide just, which is my last slide, just makes one point, and hopefully it makes a difference, that we're not just talking the talk, we're walking the walk. So the first picture is me on December 21st receiving my first vaccine, and then 21 days later, because I had Pfizer, received my second. I'd be happy to talk about side effects if we have time in the Q&A, but I thought I'd just raise those important points because it is my opinion and my position that in order for us to reach herd immunity and to stop the number of deaths, remember, we've had 3,000 to 4,000 people dying every single day in America, and from a disproportionate perspective, most of them are African-American or from the Latinx community. So we, brown and Black communities, cannot afford to sit back and do nothing, because we can forecast exactly what will happen if we do nothing. Instead, we've got to do something, and the best choice, and the only other way for us to get through this pandemic and reach herd immunity so that we can remove our masks, no longer social distance, and get back to some degree of normalcy, is if we reach herd immunity through the vaccine. Senator, that is all I have. I want to yield the mic back to you.
Well, thank you very much, Brother Eadie. We appreciate that. Hopefully that was enlightening, and definitely it was very informative, giving us all some insight into the vaccine angst, so to speak. So next up, we have a good friend and a co-worker, Dr. Janae Khaldun, the Chief Medical Executive for the state of Michigan and Chief Deputy Director for the Health in the Michigan Department of Health and Human Services, or MDHHS. In these roles, she provides overall medical guidance for the state of Michigan as a cabinet member of the governor here in Michigan, and oversees public health and aging programs, Medicaid, and behavioral health for MDHHS. Prior to her role at the MDHHS in the state of Michigan, she was a director and health officer for the Detroit Health Department, where she oversaw a robust community health assessment, established comprehensive reproductive health network, spearheaded new human service efforts, and led Detroit's response to the largest hepatitis A outbreak in modern history. And just recently, she was appointed to President Biden's Health Equity Task Force. So I present to you my good friend, Dr. Janae Khaldun, AKA Dr. J.
Good evening, everyone. Thank you so much for having me on today. I want to thank the Michigan Legislative Black Caucus and, of course, the chair, Senator Marshall Bullock, good friend, for hosting this event. And it's also always good to see Dr. Eadie as well. Welcome back home. So as Dr. Eadie said, the past 12 months, and we all know this, they have just been incredibly challenging. We saw a surge in cases last spring, but also this past fall. And I'll tell you, I don't know of any Black or Brown person that doesn't know of someone, whether it's a friend or a family member, who has died due to this terrible virus. I myself have had family members who have been ill. I've had people who trained me. I trained in New York City in emergency medicine. 2 people who trained me passed away from this terrible virus. So it has really hit the healthcare community and people of color quite hard. I will say Michigan has actually done quite well over the past 6 weeks, much better, quite frankly, than most states in the country, and also in the Midwest. We largely avoided the post-Christmas and New Year's surge, and our cases have come down dramatically in our percent of tests. So that's how many tests we're doing are coming back positive. That percent positivity has come down significantly. We're now under 5%, and less than 5% of our hospital beds across the entire state are now being used to treat patients who have COVID-19. So we're doing quite well. That said, we are definitely still not out of the woods. I know people in Michigan may be tired of hearing me say that for the past 12 months, but we definitely are not. COVID is still very, very present in our community. We have this new variant that you've heard a lot about, the B117 variant in particular. We have identified over 150 cases in Michigan. It's more easily transmitted from person to person. And so we have a risk of more outbreaks and more hospitalizations and deaths because of that variant. And we probably have more cases than we have already identified through testing. So I have to emphasize this every time I speak, we all have to remain vigilant and do the basics. That means wearing a mask, washing hands, still social distancing, and of course, getting a vaccine when one becomes available to you. So, like I said, we know COVID-19 has really hit our Black and Brown communities hard. Here in Michigan, African Americans make up about 14% of the population. Back in April, African Americans were 32% of cases and 40% of all deaths due to COVID-19. And just to be clear, this has absolutely nothing to do with race. This has everything to do with racism, systemic racism, racism in the past, as Dr. Eadie talked about, but quite frankly, and I still practice emergency medicine in Detroit, in the Henry Ford Hospital, we still have racism in our healthcare systems across the entire country, implicit and sometimes explicit bias. So those are the reasons why we historically have seen Black and Brown communities less able to achieve optimal health. And it also contributes to, I think, the valid reasons why Black and Brown communities are hesitant to engage with the healthcare system sometimes. But I'll say, as a state, when we identified that disparity, and we were one of the first states to identify the disparity in cases and deaths when it comes to COVID-19, we took action. And under the leadership of Governor Whitmer and Lieutenant Governor Garland Gilchrist, we formed a task force. And so the Michigan Coronavirus Task Force on Racial Disparities, with their leadership, we expanded free neighborhood testing sites in communities of color across the entire state. We distributed over 6 million free masks for people, and we funded over 30 community-based organizations to really target efforts in communities of color. And also, we spent a lot of money on our targeted messaging campaign to make sure that everyone knew what they needed to do to protect themselves from this virus. And I'm happy to say, because of the great work of the task force and the leadership in this state, we were able to reduce this disparity, and African Americans are no longer overrepresented in COVID-19 cases and deaths. I'll say this is obviously wonderful, but this progress is very fragile. We still do have disparities when it comes to Latinx communities, tribes, and we really have to make sure we continue to work hard to eliminate the disparities in the state when it comes to COVID-19. And one of the most important tools we have to do that, and the topic of this evening's event, are these safe and effective COVID-19 vaccines, as Dr. Eadie went through. These vaccines, they were studied in tens of thousands of people. They were studied the studies included people of color. Some of the researchers who were involved in the studies were people of color. The science and technology used to develop the vaccines was not rushed. And in fact, some of this, the messenger RNA technology is not new. It had actually been studied for decades, which is why they were ready to go into clinical trials in 2020 when we saw COVID-19. And even though the process was condensed, there were absolutely no steps that were skipped in the process of bringing these vaccines to the market through the emergency use approval process. So I'm really pleased with the progress we've made on vaccinations since they were first made available to the states in December. In Michigan, we've distributed almost 2.3 million doses of the vaccine across the state. And to be clear, every single dose that is available to the state of Michigan, it's either in an arm or it is scheduled to be in an arm. So I want to make that very clear. There are no freezers anywhere in Lansing where we're keeping doses and not giving them to our providers across the state. We're getting them all out and we're making sure people are getting vaccinated as quickly as possible. Our goal is to vaccinate 70% of Michiganders aged 16 and up as quickly as possible. And we're well on our way. As of today, almost 14% of Michiganders have already gotten at least one dose of the vaccine, either Moderna or Pfizer, and over 35%, over a third of people over the age of 75 have gotten a shot. Over 500,000 people, so about 514,000 people in the state, have already been fully vaccinated. So that means they've actually gotten both of their doses of the vaccine. So that is great. That means that people are immune, at least 95% effective, these vaccines. So they're much less likely to get the virus. And if they do get the virus, they're probably not going to be in the hospital or end up dying. And that's great news. I also say we're focusing on equity. So your ability, of course, to get a vaccine, it should not be impacted by whether you are in a rural or urban part of the state, whether you're lower income, a racial ethnic minority, don't have access to a car, a computer, internet, or don't speak English. None of those things should have an impact on whether or not you can get a vaccine. Also, as a state, we have set a goal that no one should have to drive more than 20 minutes to get to a vaccination site, and we're taking that very seriously. We're not quite there yet, but that is our goal. And as we get more vaccines in the state, we'll be able to get more vaccination sites online and make sure that is a reality. So we're on our way. We're supporting more and more vaccine partnerships with local health departments, hospitals, and community-based organizations who are offering vaccines. And it's important, not just at mass vaccination sites, but also embedded in neighborhoods. Partnerships with community-based organizations and churches, things like that are really, really important to break down barriers to access. So here in Michigan, currently, healthcare workers, and that's the group that started with eligibility, healthcare workers and people living or working in nursing homes and long-term care facilities are eligible to be vaccinated. We, in the middle of January, moved forward with vaccinating people who are over the age of 65, some frontline essential workers like teachers, police officers, firefighters, and people who work in congregate settings like prisons or homeless shelters. All those people right now are eligible to be vaccinated. We also this past Monday announced that people who are working in food and agricultural settings can be vaccinated. And for organizations that have a very specific and targeted plan to vaccinate vulnerable populations, they can actually apply to get additional vaccine to vaccinate people aged 60 and up. So the best thing you can do if you want to get a vaccine and if you believe you are eligible is to identify a vaccine site. And you can go to our website, michigan.gov/COVID vaccine, to identify a location that may be nearest you, usually starting with your local health department. You can also call 211. We do have a partnership with 211 where you can call them and they can help you identify a place to be able to get vaccinated. The other thing that's really important is that we really don't want people to show up any place without an appointment. Unfortunately, that won't work. There will not be a vaccine available for you if you do that. We are making sure this is a very organized process. There are logistics when it comes to how the vaccines have to be stored and thawed and managed. So unfortunately, you can't just show up to a place to get a vaccine. But we're working hard to bring more and more vaccines into the state. But we ask for your patience because unfortunately, even though we've seen over the past several weeks, especially since President Biden came into office, we've seen a steady increase in the availability of vaccines to the states, but there is still not nearly enough vaccines available for everyone who wants a vaccine and is eligible today. But please be patient. We are working hard, and we expect everyone who wants a vaccine to be able to get one. So with that, I'll turn it back over to Senator Bullock. Thank you for your time this evening, and I look forward to answering some questions.
Thank you for that. Thank you, Dr. Janae. And I actually want you to touch on something else while Virginia posts the contact information and stuff and the website for us momentarily, is that I want to do a little myth busting before we go to Q&A. Is the governor isn't in charge of the rollout. She's just in charge of basically the ask for the vaccine, and folks got to go to their county health department, and then those things, they're community-based places. So I wanted you to touch on that, and then we will move forward to a Q&A session.
That's right. There are no state, there's no mass vaccination site that's run by the state of Michigan directly. We order for the providers across the state, and it goes directly to them. So you can go to our website. As I mentioned, you can call 211, your local health department, some federally qualified health centers. There are also some pharmacies across the state that are now getting shipments of vaccine directly from the federal government. But you see it right there. Those are places you can go to try to find a place to receive a vaccine.
And so we will post that again near the end. We're going to go Q&A. KW, are you available to check out the questions in the chat? I know that Mary Kavanaugh, Rep. Kavanaugh, had a question about our disabled community in the state of Michigan for Dr. Janae. And then Executive Director Johnson had a question for Dr. Eadie regarding comparisons of Moderna and Pfizer. There was something, I don't know if you stated it or we missed it, or he had a question regarding that. So
there were Director Johnson had just listed a article to read from the Los Angeles Times of the comparison between Moderna and Pfizer.
Oh, okay.
And Mary Kavanaugh is has had the only two questions. One of them I forwarded to you, which was, does the efficacy change for Pfizer and Moderna with new strains being seen?
Either one of you can take that, Dr. Eadie, Dr. J.
Yeah, so I just happened to turn on CNN prior to logging in, and the news break was that it has been definitively stated that Pfizer is effective against the current variants. And the same thing applies to Moderna. But that is not to say, remember, viruses like humans do whatever they need to do to survive. And so they're going to continue to mutate so that they can be resistant to the vaccines or whatever other defenses that exist, either externally or internally in reference to the human body. So it's just a matter of time. I like to look at it like it's a race against, do we as a country get herd immunity, or before, and that would be the finish line, before the virus creates a mutation whereby all the vaccination work that the state of Michigan has done so well no longer matters, and we've got to sort of start all over. So the faster we can roll up our sleeves and reach herd immunity at probably about, and this is a guess, 80% of us, we'll be okay. But it's a race against time, and the viruses have been around long enough that they know exactly what to do and how to do it to maintain their existence. Thanks.
Okay. And then this is a question, I believe it's for Dr. Khaldun. Do we have an update regarding disabled residents in Michigan getting the vaccine sooner due to their vulnerability?
Absolutely. So part of our vaccination strategy is, as I said, we don't want anyone to have any barriers to access to being vaccinated. So we are actually working with our local health departments and as a state on our homebound strategy, making sure that people who are homebound, people who can't come to a mass vaccination site, people who are more vulnerable to severe illness are able to get a vaccine. Unfortunately, and again, it's the fact around the entire country, we don't have enough vaccine for everyone who, quite frankly, should get a vaccine. I wish I didn't have to be saying that there are eligibility groups, right? That's not a place that any of us like to be in. But we are following CDC guidelines when it comes to the priorities. We are trying to move as quickly as we can as we get more vaccine into the state to open up the eligibility groups. And there are, at the local level, our local health departments are, as they have more and more vaccine available, able to expand eligibility as they see fit. And that is happening for our disabled community as well across the state.
And I know some folks have some more questions, but two things I wanted to ask both of you. The first one is about age. So the young folks, our teenagers, our middle schoolers, are they to, at some point, will we be vaccinating them?
Sure. Yeah. So phase 4, if you guys recall those phasing, at least the initial approach that we were taking from as a country from an FDA recommendation or CDC recommendation, phase 4 will open eligibility to everyone. Now, different states and your governor, just like the governor here, has the right to decide. And I'm sure they listen to people like Dr. Khaldun to understand what the next best step is. What's important to know about the younger ages, I think, is that you probably have heard or read recently that in a young child, they found the UK variant. So this is very serious. We're starting to see now that the younger age groups are starting to demonstrate the existence and the morbidity and mortality starting to, just as adults do in this country. So again, it's a race against time. Either we reach herd immunity or we'll be starting this thing over and prolonging our experience in this current parapandemic state.
All right, Brother Knox, another question popped in through there.
Yes, this is from Kyle McCree. After people who are eligible get the vaccine, what are the COVID safety measures that they still need to follow?
Yeah, I would say, and Dr. Eadie, please chime in as well, but it's actually still important that people who get a vaccine still wear their mask. And that's based on the data that we know about these vaccines. We know that it prevents illness, people getting sick symptomatically, but we don't know actually if it prevents it from being transmitted from person to person. It probably does, but it's still too early to know. So again, until we really reach that herd immunity and get more and more people vaccinated and stop this virus jumping from person to person with these vaccines, we all still have to do those basic things: wearing masks, social distancing, and washing hands.
Yeah, the only thing I'd add to that is, remember, our characteristics of these variants is it has increased spreadability, meaning it can jump from human to human much easier than the first phase or surge and second surge we've experienced. So this is technically, in my mind, sort of a different animal or a different virus, so to speak. And so we, again, as you just heard so eloquently from Dr. Khaldun, and we have to maintain our compliance with the recommendations until we get through this. And it, unfortunately, is not going to be as early or as soon as we hoped it to be.
And the next question is for both of you, because I want to know what you guys are doing out there. Dr. Eadie, is, I see we got another question, is what are the strategies both of your groups or the state are doing for, and Dr. J touched on it, the homebound. Are we doing mobile units in Michigan? Are you guys doing mobile units out there? And what kind of strategy are you guys using? And we can share and make sure that our community-based systems are reaching those folks who can't get out the house, who probably are high risk and live with relatives.
Yeah, one of the things about this whole pandemic experience, starting with testing, because I'm sure you guys learned a lot about testing just as we did. We first started off and bragged that we were the first healthcare system in New England to have the drive-through testing, but we totally we weren't smart enough to remember that everybody doesn't have a car. You had to have a prescription to get tested. We forgot about the social determinants of health access. So we wisened up a bit. We partner with other healthcare systems or agencies, particularly one FQHC as far as I'm concerned, and we decided to be smart enough to take the testing to the community. Then came the vaccine, right? Because remember, the test is for detection, the vaccine is for protection. So in order to protect the people, when you consider all the social determinants of health, we can't expect them to get the health care that we've been imposing upon them for many years. As Dr. J said, I mean, systemic racism is real and very present within the healthcare space. And so now we have mobile units. We're going to apartment buildings. We got that idea from our neighboring state, New York. And then most importantly, we're asking the community, what do you want? How do you want to learn about the vaccine? How do you want it to deliver to you and your communities? How do you want to communicate it? So we're listening to them so that we can better partner with them and make it easier for them. Because otherwise, we're smart enough to know that this, because you have an MD or a JD, whatever your degree is, we in situations like this, many of us are detached from those communities, although they're a part of our community, and we need to just take a step back, get to their level and ask them the best way to be served. And then we must serve them effectively and efficiently in order to get through that. You can't leave one single community behind and reach herd immunity. That's just a rule we're gonna have to live with.
Yeah, that's right. Same lessons we learned again with the Racial Disparities Task Force in Michigan. And even when I was in Detroit with hepatitis A, we had our mobile units. We went out into the community. We went out to places where people were and we're vaccinating on site. And that's what we're doing across the state. I think we still have a ways to go as far as getting more funding, quite frankly, so we can get more mobile vans. We still need more vaccine, but we are revving up those strategies. And there's some different health systems and local health departments across the state that are already doing homebound, neighborhood-based community vaccination sites.
Yeah, Dr. Khaldun, you're probably too young to remember this, but many of us recall in the city of Detroit, we had swim mobiles, we had book mobiles, and we had immunization mobiles. So how about, here it is, 2021, when we did things right back in the 60s and 70s, you fast forward, we totally forgot about the basics. But it's conversations like this, which I applaud you all and your leadership, Senator, that we are getting back to the basics and serving the community, not the way we think they want to be served, but the way they want and deserve to be served.
Yes, thank you. Because I know I'm also serve on the Racial Disparities Task Force with Dr. J, led by Garland Gilchrist, our Lieutenant Governor. Through that, I met Wayne State Medical Program, and I went out with them in my community, in my district. It didn't matter if it was my district or not. I went out with them to make sure communities were informed, went to churches with them and sat in parking lots, knocked on doors in the neighborhood to get folks out that didn't know, and we got folks tested.
Sure.
We got any more questions, Brother Knox?
I don't see any other questions. I'll check again. No other questions.
Actually, can I ask a question? I don't know if I'm being heard.
We were asking to type, but Mr. Webb, I see you. Do you have a question or a comment?
Actually, both. One, this is my first interaction, and I apply to all of you. And Dr. Calhoun, congratulations on your appointment. I recently sent an email to you. I don't know if you were able to read it. Dr. Johnson, I appreciate you responding to the email that I sent. In short, I have found precipitating factors that put people of color at risk for interstitial disease. COVID-19 is also associated with interstitial disease. By eliminating these factors that precede the COVID-19, you would reduce the amount of infections with COVID-19, pneumococcal influenza, etc. These are often perceived as congestive heart failure. Many times people are put on medications to treat this. Ironically, idiosyncratically, it contributes to more interstitial disease. And this is what I forwarded to you, Dr. Calhoun. Is there somebody that I can speak with or work with to present these findings? By addressing this, it would decrease infections such as SARS-CoV-2, also known as COVID-19, along with other infections. And it would enhance the efficacy of the vaccination. I yield.
Okay, thank you. You yield, and can you mute so we can have them respond if they'd like? And then we're going to close out with closing remarks from both Dr. J and Dr. Eadie.
I would say, Mr. Webb, I didn't receive your email, so I apologize if I missed it, but I will certainly look for it and respond. So thank you for highlighting that. Should I go ahead and give closing remarks, Senator?
Yes, sir. I mean, ma'am.
No, I just want to say, I know it's been an incredibly long 12 months. We're coming up on almost a year since we identified our first case of COVID-19 here in the state of Michigan. And you know, we keep saying it, but we're still not out of the woods. We're still in the tunnel, but there's light at the end of the tunnel. And you know, these vaccines are the tool that we have to make sure our Black and Brown communities do not continue to be ravaged by this terrible virus. So I think it's important that people have questions. You should have questions. It's okay to be a little hesitant, but I do hope that you'll seek out trusted messengers. You'll speak to community leaders. We have a Protect Michigan Commission that includes a lot of folks across the state that have information about these vaccines. And we do hope that when it's your turn, that you will choose to get the vaccine. And everyone who wants a vaccine in Michigan will eventually be able to get one. So thank you for having me on this evening.
All right, thank you, Dr. Khaldun. And before we go, closing remarks to Dr. Eadie. Virginia, can we post our survey again and see if we've, you know, got a little change in folks' minds? So the survey we started off with was, if the vaccine was available for you to take today, would you take it immediately, take it eventually, take it only if mandated, not take it at all, or have you already been vaccinated? And so we're going to let that roll for about another 30 seconds for folks to respond. And in the meantime, what I will say, this is the Operation Warp Speed and the politics of the day, and whether you trusted the commander in chief, don't let that influence your trust about this vaccine, which was actually, one of them was actually led and created by a strong, phenomenal Black female doctor, Dr. Corbett, with the Moderna. So let's not get those things confused. Our trust for the government versus our trust for those that created this vaccine for our communities. So with that, I'd like to close out the exit poll. And then, did we change some minds, Virginia? I'm not looking at it. So we got a 78% take it immediately, and then a 22% of I've already taken the vaccine. That's almost the whole 100%. So we don't have some eventuallys and some mandate. I'm glad to hear that. I'm glad to hear that. I actually get to take mine tomorrow, and so hopefully that will be great. And we're going to close out with my good friend, Dr. Eadie. We're going to record this, and as soon as Dr. Eadie closes out, Virginia, can we post the contact information again in the state of Michigan, the 211, the website, et cetera, and we'll let that sit for 60 seconds, and then we'll close the meeting out. And we'd like to thank everybody. So Dr. Eadie.
Yeah, so first of all, let me say thank you to you and your leadership, to the legislators who work so hard and tirelessly and are underpaid and underappreciated. We thank you. Dr. Khaldun, it's always a pleasure. I admire you for many things. Your brilliance is at the top of the list, so keep doing what you're doing. You know, I started off my few minutes in presentation with some data that one could view as being negative or from a pessimistic perspective. So I wanted to end on something positive. I think it's positive, certainly as a challenge. So, you know, one thing about America is we all got here on different ships, but this pandemic, if I can find a silver lining in it, it puts us all on the same boat. And so here it is, you know, silver lining. I think God allowed this pandemic to happen for whatever reason. But one of the many things that it did that I'll just lift up is that it illuminated this problem that has been in existence in this country for far too long. And that's the system that marginalizes groups of people intentionally. And so as policymakers, you know, we support you in getting down to the fundamentals. It was policy that got us into this mess, from redlining to the Highway Act of 1956 and any other historical reference that you and your elders and your family can point to. It's still real today. It is not coincidental that the hot spots in America are these same neighborhoods that redlining and the Highway Act produced, to get the so-called ghettos. And so we're going to get through this pandemic. We're going to get through this pandemic successfully, but shame on us as a people, as a brown and Black community, if we don't continue such conversations so that we can point at the policymakers of the past and the policies of the past and say, never again, when 100 years from now, when an infectious agent comes and creates another pandemic, brown and Black people won't be caught up in the middle. You know, it's shameful that it appears as if our federal partners are pointing at us as if it's our fault because we have hesitancy. So we need to undo that hesitancy conversation. I'm trying to lead that here in Connecticut. Let's stop talking about hesitancy because that's old news now. This data that the poll you guys just took proves that. Now we need to start talking about things like access. And when we talk about access to the vaccine, we can follow it up with access to education, access to employment, access to knowledge, access to a seat at the table. And then we can change this America into the America that it should be, that it used to be prior to modern day America being developed and the America that we deserve and God intended it to be. I know I'm long-winded, but I am very passionate about this, and I'm passionate about my city, Detroit, and my state, Michigan. So God bless you all and keep doing what you do. And by any means, if I can partner with you, Dr. Khaldun, I'll be more than happy to do so, although I'm 5 states away. But I'm officially still a resident of the city of Detroit. God bless you, and I love you all.
Thank you, Dr. Eadie. And I would like to just say thank you both for taking time out to be a part of this forum. It's been recorded. We're going to post it on all our social medias. And I did, for a minute, I saw Derek Ivory.
I'm right here.
Derek Ivory is, this is totally not scheduled, but Derek Ivory is the district representative for the Midwest great states of Michigan, Minnesota, Illinois, Indiana, and Wisconsin from Omega Psi Phi. And he has been at the forefront of getting information out through our fraternity with brothers like Dr. Eadie on making sure that folks got tested and getting the vaccine. So we just want to acknowledge your presence, brother.
Brother Bullock, thanks for allowing me to speak at all. I just want to congratulate you all on keeping this in the forefront and keeping the voice in our community heard. If we stop talking about it, then it would become mute to other people's ears. So we want to keep mentioning it and keep raising the voice and keep raising awareness to issues like this. And I know from your seat, you're doing an excellent job of doing that by some of the videos you send me, because I'm not on Facebook. But I appreciate that of those videos you do send me. So keep uplifting and keep doing what we're doing in the community. And Detroit is one of my strongest areas that I support. And you guys are doing a terrific job. And I know hear Brother Eadie on the prayer call in the morning, bright and early. So I know he's out there active.
Beautiful, beautiful. We appreciate you, DR, and be ready to come back to Lansing for another event of Q's at the Capitol. So with that, Virginia, can you post our contact information? And we're going to close out. And I'd like to thank everybody. Good night. God bless.